Well, let's talk to the Secretary of State for Health, Matt Hancock, who joins us now from central London. A very good morning to you. We're going to talk about all the details of the restrictions in a moment, if we may. Firstly, can I just put to you what Sir Keir Starmer, the leader of the Labour Party, has said, which is, when you're bringing in stuff like this, announcing it late night on Twitter is not the way to do it. How do you expect people to have any idea what's going on this morning?
Well, we made the announcement last night. We are moving quickly in some circumstances, and I think that's very important. And it's one of the things that when you face a pandemic like this, it is important sometimes to move quickly if that's what's needed. I'm pleased that Andy Burnham, the Mayor of Greater Manchester, is supporting this action. It's absolutely necessary, of course we have to. Sometimes we have to move quickly when we can see the growth of the virus. And I understand the impact of decisions like these. I understand that this is not the sort of decision anybody would want to take. But as we've seen before, it is important to move quickly because the virus spreads, and you've got to make sure that you do everything you can to keep ahead of it.
These restrictions are, to be fair though, a little bit confusing, aren't they? The idea that you can't meet people, you can't visit homes, you can't visit private gardens, but the pubs aren't closing, the hairdressers aren't closing, the people are still meant to be going to work. It's not clear. It's not as clear cut as a lockdown. Why not take it one step further?
Well, of course, it is absolutely crystal clear, precisely as you said, what the new rules are. And we've brought them in to target specifically the problems that we've been able to see through the data, because we want to keep in control of the spread of this virus. We want to do that with the minimal impact on people's lives. I appreciate these decisions do have significant impacts on people's lives, but we want to do it with the minimum impact. And the evidence shows that the biggest risk in terms of the spread of this virus across this area is household transmission, when people are going to see each other in their own, in each other's homes when they're not in a household together, and also visiting friends and relatives. Actually, we're not seeing as much transmission in terms of people in their place of work or going to retail or other areas. And so we are able to put in place this specific action. We're not restricting travel, so people can still go on holiday from the area affected, for instance, and we're not putting in any restrictions to work, so people can still go to work. But we have seen a significant increase in the spread of the virus in this area, and our data from the test and trace system shows that is mostly from households meeting each other. So that's why we've brought this very specific measure in. It's absolutely crystal clear what the measure is, which is that you shouldn't socialise with people in other households except in public outdoor places, so not in your own home or your garden. You can go to the pub, but with members of your own household. And that applies to other areas of hospitality as well. So the rules are absolutely crystal clear. We brought them in rapidly because we had to, and we entirely understand the impact that this has.
Forgive me for interrupting. I mean, you keep talking about this being very specific, and in some respects, people can see that it is specific, but perhaps not specific enough according to others. I mean, Bill Wragg, the MP, and Graham Brady, the chair of the 1922, both concerned, raising comments on Twitter about the fact that all 10 boroughs in Greater Manchester, which are areas that obviously they represent, are brought in. I mean, Sir Graham saying, Trafford has infections at a low level, according to the latest update there. So if you're being specific, why then target all 10 boroughs?
Well, we absolutely looked at what was the right geography for this decision. Unfortunately, we have seen an increase in the number of cases in Trafford, and we also worked with the local authority and the local authorities within Greater Manchester, including the mayor, and took the decision to apply this across the whole of Greater Manchester. The reason for that is that we've seen these increases across the board, but in Greater Manchester, as well as the other areas that are affected. And also, the problem was that we had taken more targeted, more specific local action, for instance, in Oldham and Blackburn, but we could see that it was spreading more widely than that. So we had to take the action that we did. Everybody can see that the problem with this virus is it thrives on the social contact, that makes life worth living. And so I totally understand the human impact of this, but unfortunately, that is how the virus passes on. And it's so important that we keep the virus under control in this country, especially as we see a rise in the number of cases in the rest of the world and this spike that we're seeing in the rest of Europe. We've always said all along we'll be vigilant and we'll take action if necessary, and that's why we took the action as swiftly that we did.
I mean, you've talked about a lack of social distancing being responsible for this. How much of an impact have the Eid celebrations had, do you think? Is that a defining factor?
Well, my heart goes out to our friends in the Muslim community who were affected by this ahead of Eid. I understand the impact. I'm incredibly grateful for the work of imams locally and other local religious leaders to put in place socially distant, COVID-secure celebrations, for instance, which they're doing in parks, because outside is safer than inside. But it is important that that people across the whole community follow the social distancing rules and follow these new rules of not having more than one household meet. And by a household, of course, we mean a group of people who live together in one house. It does not mean a wider extended family. And this is important for everybody across the area. But I also recognise that with Eid celebrations tonight, I very much wish our Muslim communities Eid Mubarak tonight. It will be different this time, and it's really important that these new rules are followed in the Eid celebrations and across the board.
I mean, there has been a problem in the areas that you've targeted with this, and as you say, Andy Burnham agrees with you on that. But we know that the R figure, we've had this drilled into us by you and the Prime Minister and others, that the R figure is so important. When we're hearing that reproduction rate is 1.04 in the southwest, 1.02 in the southeast, and under 1 still in the northwest, it begs the question whether you think, even if it hasn't been taken up until now, which it hasn't, whether you think there is going to have to be further action in the southwest and indeed in the capital, southeast, and indeed in the capital itself in the coming weeks. I mean, is that looking like a possibility?
Well, we've demonstrated that we're prepared to take the action that's necessary to keep people safe. That was true in Leicester when we took action there. And we're taking much more localised action in hundreds of different locations right across the country. And we are seeing in some parts of the country that increase in the number of cases, and we take action where we need to. Now, in the southwest and the southeast of England, thankfully the number of cases is much, much lower. So we haven't had to take this sort of action, but we don't shy away from taking it wherever it's necessary. We, of course, would rather not, because of the impact that it has on people's lives. I get that, but we're prepared to if that's needed.
Look, when it comes to these specific areas, and indeed looking at what we may have to do in the coming weeks and months, what is the government strategy now when it comes to COVID-19? Because previously it was a very clear strategy of protecting the NHS. Are we at a point now where that is still the goal, or have we moved forward to eradicating the virus?
Well, we've been very, very clear about that, and this action is part of the strategy for keeping the virus right down. We brought the number of cases right down. Where we've seen an increase, we've acted. We want to act locally as possible. I appreciate that this is bigger than a local area, across parts of the north of England, but we want to take as local action as possible. But the strategy is really clear, which is to get the virus down, to hold the rates of spread down, whilst allowing for as much freedom and return to the things that make life worth living as we possibly can. And that's the strategy. It's really clear. This action is part of that. It means that we've been able to free up things where that's been possible, but also where we've seen the spread, especially due to the household to household transmission, then we're prepared to take the action that's needed to keep everybody safe.